A patient today asked about the potency of antipsychotic medications. They had heard the term high potency neuroleptics and the term low potency neuroleptics and were just curious as to what that meant. They also had concerns about side effects with certain medications, and so I thought that it was important that we did talk about this quite a bit. Potency of a medication really refers to the amount of medication needed for it to do its job. And so when you think about a high potency medication, think about a medication where only a small number of milligrams are needed for a particular dose. Medications in psychiatry, like Haldol or Risperdal or Prolixin, these medications, a dose for a patient might be 1 milligram or 2 milligrams or 5 milligrams. And they might be actually pretty effective at those milligram doses to block the dopamine 2 receptor strongly enough to decrease the person's hallucinations or delusions and to really help them with their symptoms. So low potency, high potency medication would just need a small amount of medication to do its job. A low potency medication may need a higher number of milligrams to do the same job. So to get the same amount of symptom relief when using an antipsychotic for a patient, when you're using a low potency medication, instead of 1 milligram or 2 milligrams or 5 milligrams of Haldol, which is haloperidol, you might need 300 milligrams of Thorazine, which is chlorpromazine, to do the same amount of work in terms of decreasing those hallucinations or those delusions. So you may be wondering, well, why wouldn't everyone just use the very high potency medications where you only need a milligram or two to help the patient with their symptoms? Well, different potencies of medications can actually cause someone to be more or less vulnerable to specific side effects. For example, EPS or extrapyramidal side effects can be pretty distressing and pretty significant side effects for your early antipsychotics, like your first generation antipsychotics. The higher the potency, so the lower number of milligrams needed for that medication to do its job. So the high potency medications in that category, like Haldol, which is haloperidol, and Prolixin, which is fluphenazine, those medications have a higher risk of tardive dyskinesia, which is potentially a permanent movement disorder that can be pretty disfiguring. It's involuntary, it's not painful, but it can be pretty disfiguring because you get these abnormal movements of your mouth or your tongue that you can't control, and people will be, it's obviously pretty noticeable when you see that. They also have increased risk for akathisia, so that's like this significant inner restlessness, feeling like you're crawling out of your skin from taking these medications. That can be incredibly distressing. People feel like they need to constantly move to try to get rid of that sensation, but you just can't get comfortable no matter what they do. Parkinsonism, you have a higher chance of Parkinsonism with your high potency medications like haloperidol and fluphenazine. And symptoms of Parkinsonism could be a blunted affect or masked facies, where there's not a lot of expression in your face. Bradykinesia, where when you're walking, you can only take really short stutter steps, and that can make you more vulnerable to falling when you walk, or just make it more difficult for you to ambulate. Tremor, cogwheel rigidity, so really kind of stiff and rigidness in your wrists, for example, is also a symptom of Parkinsonism. Then dystonias as well. Dystonias are more likely to occur in your high potency neuroleptics, and that would be a kind of a sharp contraction of muscles in your shoulder or your neck so that you actually can't move until you get treatment, until the medication wears off. Treatment for that is typically Benadryl. But your lower potency medications, where you might need hundreds of milligrams, they have less of a risk of EPS and less of a risk of some of those side effects that we were just talking about, including permanent movement disorder. But they might not also always be the best option, because those medications, because you need so many more milligrams, they're just a lot less potent, and they tend to hit other types of receptors, like anticholinergic receptors and antihistaminic receptors, and cause more sedation, for example, more urinary retention, more orthostatic hypotension. When you stand up, you might feel dizzy or lightheaded. Will be a higher risk for fall, maybe increased appetite and other symptoms. So the bottom line is that it's very complex when choosing one of these medications, and you want to work with a mental health professional who really understands this and also takes a thorough history to see what your specific concerns are, how you respond to other medications in the past, to make an educated decision with you, to collaborate together with you to sort out the best treatment plan when using one of these medications. If you believe this video pertained to you in any way, please be sure to talk to a mental health professional directly. The information in this video is just informative only. It's not meant to be medical advice for anyone out there.